Hey, you, if you're like many of us in the asthma friend community, you probably know that feeling all too well, the tightness, clamping down on your chest.
Oh, absolutely. Or that wheezing sound, the breathlessness, maybe that nagging cough. It's something we definitely understand here.
Yeah, it really is. And while obviously the medications our doctors give us are super important within our asthma friend community, lots of us have found real benefit in adding, well, simple, natural ways to support our breathing too.
Exactly. Alongside the meds, it's about having more tools in the toolbox, isn't it?
It really is. And that's why today we're doing a deep dive into this great resource from the Asthma Friend blog. They've got an article specifically about managing asthma naturally with daily breathing exercises.
Right. So our mission today, if you like, is to kind of unpack that, pull out the key insights.
Yeah, basically give you a shortcut to understanding how these breathing techniques can be, well, a really powerful addition to your whole asthma management plan.
And the Asthma Friend article does a good job explaining how these exercises work with your treatments, not instead of them. They can help manage symptoms, maybe even improve lung function.
And possibly cut down on flare-ups, which would be amazing.
Definitely. So let's get into how these simple exercises actually make a difference.
Okay, let's unpack it. The Asthma Friend article kicks off talking about strengthening our breathing muscles, which, when you think about it, just makes sense, right? Living with asthma, sometimes just breathing feels exhausting.
It absolutely can. You've
Yeah.
got inflammation, maybe narrowed airways.
Oh,
It's just harder work for the air to move.
yeah.
And that puts a strain on your breathing muscles.
Like the diaphragm.
Yeah, exactly. The
Yeah.
diaphragm, that big muscle down low, and also the muscles between your ribs, the intercostals, they get tired.
Uh,
So the key takeaway here is that doing these exercises regularly, it's like taking those muscles to the gym. It makes them stronger, more efficient. So each breath takes less effort.
okay, that sounds like a huge plus. Another thing, that feeling of air getting trapped during an attack. I know a lot of us in the asthma friend community experience that, like, you just can't exhale fully.
Right. Trapped air. It's a real issue. And this is where a technique like pursed lip breathing can be, well, surprisingly helpful.
Pursed lip breathing. Okay.
Yeah, it sounds simple, but when you breathe out slowly through pursed lips, almost like you're gently blowing out a candle,
Okay, I can picture that.
it creates a little bit of back pressure in your airways, just gentle pressure.
Ah, okay.
And that back pressure helps keep the smaller airways open a little longer while you're exhaling. So more of that trapped stale air can actually get out.
Right, so it improves the whole oxygen-carbon dioxide exchange.
Precisely. It helps empty the lungs more effectively. Pursed lip breathing keeps airways open longer on the out-breath. Maximizes getting that old air out.
That's really clear. So it's not just about getting air in, it's just as important to get the stale air out efficiently. Okay, the article also talks about shortness of breath. That feeling, when things tighten up, we often just start breathing faster, don't we?
And
And shallower.
it's a natural reaction. Your body senses it needs more oxygen, so it tries to speed things up. Panic response almost.
Yeah.
But, as the Asthma Friend article points out, that fast, shallow breathing can actually make things worse sometimes. It can lead to hyperventilating, more anxiety.
Which can be a trigger itself for many of us, a vicious cycle.
Exactly. So how do these controlled breathing exercises help break that cycle?
Yeah.
Well, things like diaphragmatic breathing or belly breathing, they make you consciously slow down. You
Hmm.
regulate your breathing rate, you take deeper breaths,
Okay.
and that interrupts that rapid, shallow pattern. It helps bring things back to a more normal, efficient rhythm, which eases that feeling of breathlessness. It gives you back some control.
That makes a lot of sense, knowing you have something you can do in that moment.
Yeah.
Now, this next point, stress and anxiety triggering asthma. That's a big one for me, and I bet for many in the asthma friend community. How do breathing exercises help with that?
Yeah, it's a huge connection.
Mhm.
It ties into our nervous system. You've got the fight or flight side, the sympathetic,
Right, the stress response.
and then you've got the rest and digest side, the parasympathetic. The Asthma Friend article explains that slow, mindful breathing actually activates that calming parasympathetic system.
Ah, okay.
So basically, by slowing your breath down deliberately, you're sending a signal to your body saying, hey, it's okay, you can calm down now. It counteracts the panic.
That's powerful. Just taking a few slow, deep breaths can feel like you're hitting reset.
It really can. And one last point on how these help. The article mentions becoming more aware of early symptoms, like catching things sooner.
That sounds incredibly useful, getting ahead of an attack.
It really is. When you practice mindful breathing daily, even for just a few minutes, you start to tune in more. You get more sensitive to subtle changes.
Like a slight tightness you might have ignored before?
Exactly, or a tiny wheeze, things you might have missed. This awareness means you can act sooner, maybe use your reliever inhaler, before it escalates into something bigger. It's like fine-tuning your internal warning system.
That's a great way to put it. Okay, so we know why they help. Now, the Asthma Friend article details some specific techniques. Let's dive into those. First up, pursed lip breathing, which we mentioned. Quick refresher on how to do it.
Sure. It's really straightforward. You breathe in slowly through your nose, nice and easy.
Okay.
Then you purse your lips, like you're going to whistle softly, and breathe out slowly through your mouth. The key is making the exhale longer than the inhale.
Longer exhale.
Yeah, maybe breathe in for a count of 2 and out for a count of 4, roughly.
Yeah.
And remember the benefit. That back pressure keeps airways open, helps empty the lungs.
Got it. In through the nose, long, slow exhale through pursed lips. Okay. Next is diaphragmatic breathing. Belly breathing. What's the main idea there?
With belly breathing, the goal is to really use your diaphragm, that main breathing muscle. So when you breathe in, you focus on letting your belly expand outwards.
Instead of your chest rising.
Yeah, you can put one hand on your chest, one on your belly. The hand on your belly should rise as you inhale, while the one on your chest stays. So Buteyko focuses on exercises, including some gentle breath holds after exhaling, designed to help you reduce your breathing rate and volume, retraining yourself to breathe more lightly, more gently.
Okay, reducing the amount you're breathing and the Papworth method.
The Papworth method is kind of cool because it blends breathing techniques, mainly gentle diaphragmatic breathing, with relaxation practices.
So mind and body together.
Exactly. It's about finding a calm, natural breathing rhythm and using relaxation to ease tension, which can help manage symptoms.
Right. Breathing plus relaxation. Okay, so the Asthma Friend article gives a really practical, simple daily routine. Morning and evening. Let's walk through that. The morning routine is just 5 minutes. Starts with 2 minutes of diaphragmatic or belly breathing. How do we do that again?
Okay, so find a comfy spot, sit tall in a chair, or lie down relaxed. Put one hand on your upper chest, the other low on your belly. Breathe in slowly through your nose, focusing on making that hand on your belly rise up. Keep the chest hand still, then breathe out slowly, maybe through pursed lips, feeling the belly hand fall. Just keep that gentle rhythm going for about 2 minutes.
Nice and easy way to start. Then the routine adds 3 minutes of pursed lip breathing. What's key to remember for this part?
Keep it slow and controlled, that rhythm, remember.
Yeah.
In through the nose for maybe 2 counts, then out slowly through pursed lips for 4 counts. Really focus on that long, steady exhale, letting all the air out comfortably.
Okay, 2 minutes belly breathing, 3 minutes pursed lip, 5 minutes total. Totally doable. Now, the evening routine is a bit longer, 10 minutes. First half, 5 minutes, is mindful breathing, described as Buteyko inspired. What's that like?
Right, so again, find a quiet, comfy place to sit. Just breathe normally, gently, in through your nose and softly out through your nose.
Okay.
Then, after you exhale naturally, just pause your breathing gently for a few seconds. Start small, maybe 3 to 5 seconds. Don't strain. Then just go back to normal, relaxed breathing.
So, gentle in, gentle out, short pause.
Yeah. The focus is on keeping the breath light and relaxed, reducing that overall effort, kind of like the Buteyko principle aims for.
Got it. And the final 5 minutes of the evening is relaxation breathing, drawing from the Papworth technique. How does that work?
You can lie down or sit comfortably with good posture. Close your eyes gently. Start with slow, deep diaphragmatic breaths, again feeling the belly rise and fall.
Okay, like the morning belly breathing.
Exactly. But now, as you exhale slowly, mentally scan your body from your head down to your toes. Let there's any tension anywhere. And just imagine releasing that tension with the out-breath. Consciously relax those areas. Picture stress just melting away as you breathe out.
That sounds really calming. A great way to wind down before sleep, which I know is a struggle sometimes for us in the Asthma Friend community. Okay, before we wrap this deep dive, the Asthma Friend article shared some final, really important tips. First one, consistency.
Absolutely crucial. Like any exercise, you get the most benefit from these breathing techniques if you do them regularly, daily, ideally. Even just that 10 or 15 minutes a day, done consistently, helps build up that lung resilience over time.
Makes sense. Little and often. Another key tip. Remember pursed lip breathing during a flare-up.
Yes. Don't forget that one. When you feel breathless or tight, going back to that slow exhale through pursed lips can really help you regain control. It keeps those airways open, remember?
Definitely a tool to keep handy. Now, this next one is a vital, something we always stress in the asthma friend community. These exercises support your medication, they don't replace it.
Cannot emphasize this enough. Breathing exercises are brilliant additions to your management plan, but you absolutely must keep taking your prescribed inhalers and medications exactly as your doctor told you. They are foundational.
Absolutely. And the final piece of advice ties into that. Talk to your doctor.
Always the best first step. Before you start any new structured breathing routine, have a chat with your doctor or asthma nurse. They know your specific situation and can make sure these exercises are right and safe for you personally.
Good advice. Okay, so wrapping up this deep dive into the asthma friend resources, what we've seen is that these daily breathing exercises, they're a simple drug-free way to actively support our asthma management.
Yeah, it's about empowerment, isn't it? Giving you, as part of this community, more ways to manage your breathing, lower stress, and hopefully just feel better day to day. Improve that quality of life.
And it doesn't have to be overwhelming. Like the article says, even just a few minutes each day done consistently can make a real difference over time.
Totally. Start small. Be patient with yourself. It's about building a habit.
Exactly. Whether it's trying that belly breathing in the morning or just remembering pursed lip breathing next time you feel tight, every little bit helps.
And hey, as fellow members of the Asthma Friend community, we really want to encourage you. Give it a try. Your lungs might just thank you for it later.
Well said. And listen, for loads more practical tips, hearing from others in the community, finding great resources to help you manage your asthma, please do subscribe to Asthma Friend on YouTube and follow us wherever you get your podcasts.
Yeah, connecting with others who get it, it really makes a difference. You're not alone in this.
Definitely not. So final thought for you, our Asthma Friend community listener. Think about it. How could adding even just one of these breathing techniques to your daily routine, maybe starting today, how could that shift your experience with asthma?
It's worth exploring. Check out the resources within the Asthma Friend community, find what resonates with you, and give yourself that extra support.